Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is a blood ferritin test. So let's jump straight into it. So before we get into the specifics of the blood ferritin test itself, let's explore a little bit about what you can expect when your doctor orders a blood ferritin test for you. So a ferritin test is done with the taking of a simple blood sample. So here, a needle is used to draw blood from a vein in your arm into a serum separator or SST gold top blood tube. The collected blood is then sent to a laboratory where it is analyzed and resulted. So as we can see in this little image below, we see the blood sample done through venipuncture through the vein in your arm into a gold top or SST blood tube. And then this sample is then sent off to the laboratory to be analyzed and resulted. So before we speak about the ferritin blood test and what the normal ranges mean, let's talk a little bit about what is ferritin. So ferritin is actually a protein that is found in our bodies that stores iron and releases it when our body needs it. So it is found in many cells throughout the body, particularly in the liver, the spleen, the bone marrow, and the muscles. So ferritin acts as a buffer against iron deficiency and iron overload by helping to regulate the storage and the release of iron in the body. So basically, ferritin is a protein and it actually stores in various different organs in the body. And each of these proteins actually contain iron within them. So when we have an iron deficiency or low levels of iron in the body, the ferritin actually release iron to pick up the blood iron levels. And when there's an iron overload, meaning too much iron in the body, the ferritin proteins actually store more iron within them to bring down or to normalize the blood iron levels, preventing an overload in the blood. So what is a ferritin blood test? So a ferritin blood test measures the level of ferritin in your blood. So as discussed in the previous slide, ferritin is a protein that stores iron and releases it when your body needs it. The amount of ferritin in your blood reflects the amount of stored iron in your body. So why is this clinically relevant or important in everyday medicine? So a ferritin blood test is usually done to assess iron levels. So it helps determine if you have too much or too little iron in your body, which can be a sign of various conditions. So we'll explore that aspect a bit further in the next two slides. And it's also used to diagnose conditions. So low ferritin levels can indicate an iron deficiency anemia, while high levels, on the other hand, might suggest conditions like hemochromatosis, where there's too much iron in the body, or chronic inflammatory diseases, which will also cause higher levels of ferritin. So it's usually the family doctors that order a ferritin test when their patients have symptoms of low iron, which is indicative of an iron deficiency anemia, such as fatigue, weakness, or to monitor the effectiveness of treatment for iron deficiency or iron overload. So moving along, let's discuss the normal levels of ferritin. So the normal levels of ferritin in healthy adults, for men, it's 24 to 336 nanograms per milliliter, and in women, it's 11 to 307 nanograms per milliliter. So what does it mean when we have abnormal levels of ferritin? So low ferritin levels, which will be in men less than 24 and in women less than 11, may indicate an iron deficiency anemia. It can also indicate chronic blood loss, such as from a bleeding ulcer, or perhaps poor dietary iron intake, such as in vegan or vegetarian diets. So high ferritin levels, on the other hand, which in men means anything above 336 nanograms per milliliter, and in women anything above 307 nanograms per milliliter, could suggest hemochromatosis, which is a genetic disorder that causes the body to absorb too much iron, It can also point to liver disease, chronic inflammation, such as in conditions like rheumatoid arthritis, hyperthyroidism, leukemia, taking too many iron supplements, chronic alcoholism, or certain types of cancers, such as Hodgkin's lymphoma. And that brings us to the end of this video. So as we have just seen, a ferritin blood test is important for diagnosing and managing various conditions related to iron imbalances in the body, which can significantly impact your overall health status. So thank you guys so much for watching. I hope you found this presentation quite useful and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community who you think might benefit from this video. You can also share it with patients or friends that go for regular ferritin blood tests or suffer from an iron deficiency anemia. Take care and have a great day further.